one of the key issues about insurance is that it's not like mobile money where you just can sign up and transfer money. Insurance is regulated. There are requirements for the client to understand what it is that they're purchasing, etc. So it's quite complicated to distribute very widely and broadly across the community by remote. From my perspective, the kind of population focus from where I was coming from is, really people who don't have access to terribly much healthcare, in the sense that they're, rural, or they may be, outside of formal employment, and therefore, the insurance cover is not so much something about which covers complex illnesses or complex treatments, but it's really an reimbursement of time lost due to illness.
I think there is also an element of pricing it appropriately, and specifically in health insurance, the issue is understanding the risk of whether somebody's health condition will cost 10 cents, $5, $500, or $5,000. So appropriate medication treatments, if they're properly matched to the person's conditions and their genetics, they're a very powerful tool to reducing this cost.
So there needs to be some kind of interactivity. It's not just like you can send it to them and then they have it. There needs to be an exchange of information and an agreement that they understand. Well, essentially, you're paying a premium for a return on money, and it's not associated to severities of illness and stuff. It's not a coverage. It's just cash.